Recording now, Carol.
Awesome. Oh, we've got San Diego in the house. Well, Ontario, Colorado, we're really starting to spread out right now. So welcome this evening, everybody. So happy to see you all tonight for another edition of Ask the Doctor. We had asked for some questions to be submitted before tonight, and we had stacks of them. So we're really excited to hear lots of new information tonight. So our guest speaker, of course, is the amazing Dr. Bob Rakowski, who teaches lectures and trains all over the world. And we're going to hear a whole bunch of good information, and then we'll have an opportunity to ask him as many health questions as we can possibly fit into our little time. So without any further ado, the amazing Dr. Bob Rakowski.
Well, thank you always, Carol, for opening the room, for running the show so nicely and monitoring the chat, right? So if some questions come up as we're going through, please type them in, we'll go. So sometimes, careful what you ask for. We submitted a post that said, hey, do you have any questions? And you'll look at what was on the left when I finally said, okay, that's enough for this week. Surprisingly enough, one of the things we know is that in order for any type of program to work, it has to be something that people do. And that's really the magic of what we're going to show tonight. We have a simple protocol where people can get all of these conditions better. And it's literally proven in the medical literature with a simple change every single day. Little background on me. So there's a wonderful updated picture of my family. I used to show an older one when I had a paradigm shift that was very important. But, now Kelly and I are proud grandparents. So we have little Lily there and little Leah. And then our beautiful daughters, and Lexi's not married yet, but Chad is an amazing significant other. That's the two in the back. And then Christy and Yuri married, Jacob and Megan married, and, beautiful, wonderful parents. I've got a great clinical practice. I've treated world champions from every major professional sport. I treated several elite athletes this week, as well as the other end of the spectrum. I have a passion for teaching, so I have taught over 10,000 hours of seminars to doctors on 6 continents now. And then I've seen the other end of the spectrum. And this foot I often use as a teaching tool because medicine had given up on it. They were going to cut that foot off 2 days before, or 2 days after that, sorry. And then you look at the foot 2 weeks later, and then 17 months later. And here's what I tell you, if a cell's not dead, it's got a chance to get better. And you can see that there were some dead cells. Well, those are gone, but notice it really didn't have a major impact on the function of that foot. She walks with no limp. So how powerful is that? And we can revitalize any organ system in our body as long as the cells are not dead. So one of the first questions that came in, there were 4 things grouped together, and it was anxiety, depression, PTSD, and ADHD. And they literally, asked the question, can Ganoderma help with? So one of the things that I do is I look at pubmed.gov, and then I'm going to go ahead and search and say, okay, is there any data on Ganoderma lucidum in the brain? And absolutely there is. 59 medical studies on the brain. And notice they go back to 1984 and an increase in the publications recently. And you're going to see that continue. Why? Because this is a very hot product, very safe, very effective, very powerful across a broad range of products. So now with brain health, I like to quote Daniel Amen, world-renowned neurologist. He's got a great TED Talk, his book, The End of Mental Illness. And he asked the question, what if mental health and brain health were one and the same? And we know that they are very, very, very tightly related. And here's what he said, 22 years later, 83,000 brain scans, what he knows is that we can change people's brains. And we can do it with our thoughts, we can do it with physical exercise, we can do it with nutrition, we can do it with detoxification. And I taught a brain series in the mid 2000s with a neurologist from Cornell. And here's what we teach. The brain is the most nutrient dependent, energy dependent, stress vulnerable, and toxin vulnerable system in the body. So picture this, right? It represents 2% of the body mass. It uses 20% of the body oxygen. And per unit volume, that is going to be the most oxygen of any organ system. Why does it use oxygen? Because it makes a lot of energy. It has something called a blood-brain barrier because it's very vulnerable to toxins. And by the way, stress also does horrific things to the brain. So our friend Ganoderma lucidum is also known as reishi. It is listed as the top superfood on the planet. So that is going to cover the nutrition component, all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water. And by the way, a bunch of other really good things for the brain besides that. This is a fancy reference with the language right from the medical literature. Ganoderma increases the production of mitochondrial electron transport complexes. Well, what does that mean? There's something called the electron transport chain. It makes 94.4% of human energy. There's 21 steps and 21 different nutrients, all that have impact in there. And guess what? Ganoderma improves all of those electron transport complexes, and it does have all of the essential nutrients. What about toxins? Well, this study calls it out very specifically. The Ganoderma spores, the most potent part of the mushroom, protects the brain and especially brain mitochondria from toxin damage. And 4 very significant studies, not all on the brain. The one on the left is there's a toxin known to induce Parkinson's disease called MPTP. When they give it to an animal in a single dose, they get Parkinson's disease. But someone decided, well, why don't we try giving Ganoderma with MPTP? When they did that, the animal didn't get Parkinson's. Carbon tetrachloride causes liver failure, but when they give it with Ganoderma, that doesn't happen. STZ was a chemotherapy they used to use for pancreatic cancer until they realized that they killed the cells of the pancreas to make insulin. But guess what? When they give that and give Ganoderma, they don't kill the cells of the pancreas that make insulin. And finally, Ganoderma protects against serious neural tube defects. So this was a toxin that was not a human study, it was a mouse study where they gave mice a single dose of a toxin known to cause neural tube defects in nearly 80% of the animals. But when they gave them Ganoderma with that toxin, it dropped to 20%. So some of the worst toxins in the history of the planet. Later on, someone says, well, what about epilepsy? Well, 8 specific studies on Ganoderma and epilepsy. And this one again says the spores have anti-epileptic properties. Very powerful there. And I love this story. This little boy here had a very significant brain injury. And in this picture, he's 4 years old, but he was having significant seizures in spite of taking 3 different seizure medications. So his mother brought him to me and said, look, the medicines aren't working. He can't take any more. He already has elevated liver enzymes. Can we create a natural protocol? And I said, of course. So we gave him a shake that tastes like liquid birthday cake that had Ganoderma in it. We gave him a hot chocolate that also was beyond delicious that had a megadose of Ganoderma. We gave Mom some of those spores to sprinkle on his food because the way they're processed, they're tasteless and they can basically be added to anything. I also gave him a chewable multi-chewable fish oil, very doable program for this 4-year-old boy. And within 6 months, he was seizure-free and off of medication. So I always tell people I like to do everything I can for a patient. So this is more of a complete seizure protocol. And I can tell you, we have had a lot of seizure cases that have gotten dramatically better by giving the brain what it needs to create the calming chemistry. Someone asked specifically about lupus. Well, that's one autoimmune circumstance, but there are 3 different medical studies specifically that mention Ganoderma and lupus. But here's a study on autoimmunity, and the language is very clear. Ganoderma can be used to treat and or prevent autoimmune disease. Someone asked about narcolepsy. So I don't have a study on Ganoderma and narcolepsy, but let me show you what this shows here. So it says both genetic and epidemiological evidence point towards an autoimmune mechanism in the destruction of the neurons that are going to keep the brain alert and awake. Now, here is a fascinating thing that a lot of people don't know, and I'll go back to the foot to make a point. So if those neurons are dead, you know what, we can't bring them back. But if they're just injured, if they're functional but not functioning, like so many cells on this foot, what if we could get that level of function back? And reality is we don't know until we try. But here is a fascinating fact about narcolepsy. There are 258 published medical studies on vaccines inducing narcolepsy. The H1N1 was horrific. I saw kids that came in after the H1N1 vaccine that had severe narcolepsy. And as far as we could tell, the part of their brain that controlled wakefulness was destroyed. And these kids were sleeping over 20 hours a day and feeling very zombie-like because their parents said, well, let's go get you an H1N1 shot. So here's what I always tell people to do. Use your due diligence. I won't give you my opinion on the vaccine, except you better be very careful. If I were going to put any toxin in my body, I want to make sure I had a megadose of Ganoderma on board, because we saw that it protects against major toxins. Someone asked about mast cell activation syndrome. They also asked about mastocytosis. So very specifically, 6 studies on Ganoderma and mast cells. And here's what we know. Ganoderma stabilizes mast cells. So you're not going to get this huge release of histamine, which, by the way, in very extreme cases can actually be life-threatening. It can cause problems in the airway. So here, and mast cells are releasing histamine are part of allergy. So here's a study that shows that Ganoderma is good for airway inflammatory process, allergies, and asthma. When we look at airways specifically, Ganoderma opens airways by more mechanisms than prescription inhalers. This girl was highly allergic to bee stings. She was stung in the face 5 times. When she happened to show up in the office of Dr. Justin Wubin, he took one look at her, offered a cup of coffee. She said, I don't drink coffee. He said, how about tea? She said, I don't drink tea. He said, how about hot chocolate? Good thing he had all 3 there. And she said, I love hot chocolate. He says, drink this now. And within minutes, the breathing was better. The swelling started to go down. And then, national hero in Canada, Fire Captain Brian Figuera, always serving the world, but he gets on an airplane and he'll tell the flight attendants, look, I've got emergency medical training. I've got airport training. If you need any help, call on me. So he and his beautiful wife, Francesca, were flying back from, I think it was Las Vegas. And the flight attendant taps him on the shoulder and says, hey, we've got someone here that's having a really hard time breathing. We're thinking about an emergency landing. Any ideas? So he mixed up a Ganoderma King of Coffee and just a little water so she could chug it. And within minutes, she was breathing fine. So you have the data, you have the practical cases. This is something that makes really good sense. Someone asked specifically about marginal zone cutaneous B-cell lymphoma. That's very specific. When I put that in specifically, there were no results, but how about lymphoma? And one thing that I'll tell you from a natural model, we consider cancer to be have many common factors. And by the way, genetics are 5 to 10% cancer risk, environment 90 to 95%. And that's consensus agreement from scientists all over the world. When we type in lymphoma, 15 different results on Ganoderma lymphoma. But I was at a cancer lecture over 30 years ago, and a PhD researcher walked into a room of 200 doctors, and he asked this very profound question. Now, we thought he was lecturing about cancer, so we were just scratching our head. And his first question from Dean Black was, how does a hurricane start? When someone raised their hand and gave a real technical definition, and, Dean Black says, well, that's a nice answer, but let's simplify it. A hurricane starts when conditions are just right. He then asked, how does a tornado start? Well, a tornado starts when conditions are just right. How does cancer start? When conditions are just right. And these are very well documented conditions of the perfect storm of cancer: low oxygen, low nutrients, high acid, chronic inflammation, immune suppression secondary to chronic distress. So Ganoderma increases circulation. We'll see that those references later. It increases nitric oxide. Nitric oxide dilates blood vessels. It's the top superfood on the planet. So it has all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water, along with 430 unique molecules, 79 of which are antimicrobial. It's considered the most alkaline food on the planet. It modulates the inflammatory process by at least a dozen proven mechanisms. That reference is coming. And it's a known immune support product. And in fact, that's what the national products number in Canada allows: an immune claim on Ganoderma. But let's go to the medical literature. And here is our PubMed study. It says after more than 40 years of clinical use, its efficacy, safety, and long-term tolerability have long been recognized by neurologists and other specialists. It reduces adverse reactions and improves the quality of life for cancer patients during chemotherapy. Now, there's 40 years of experience that show that. If you want to read the article, type in your Google search engine, PubMed ID : PMID : and this number, and you can get that there. This one here, very powerful study, shows that Ganoderma can abolish chemoresistance. Most people know what antibiotic resistance is. If you don't give a long enough course or a strong enough course of antibiotics, the bugs learn to fight back. Well, with chemotherapy, cancer does the same thing. It learns to fight back against the chemo. And here's what we know. If the first chemo fails, the individual's prognosis for survival goes down exponentially. Why? Because the chemo is horrifically toxic to the body. So Ganoderma can abolish chemo resistance. There's your PubMed. Ganoderma enhances the killing effect of radiation. Now they have multiple cancers where it shows that, also while protecting the normal cells. And then these are all cancers, and there's more now. I literally just found bladder cancer because someone had a bladder question when I looked up PubMed. So it helps against breast cancer, prostate cancer, inflammatory breast cancer, leukemia, lymphoma, multiple myeloma, the blood-borne cancer, cervical cancer, melanoma, lung cancer, pancreatic cancer, colorectal cancer, liver cancer, glioblastoma, the most aggressive brain cancer, endometrial cancer, gastric cancer, bladder cancer, right? And then it even can do things like block replication of the HIV virus and eradicates herpes, including like Epstein-Barr virus and herpes zoster, right? Which is shingles. Someone asked about arthritis and joint pain, 12 different studies on Ganoderma and arthritis and joint pain. This isn't joint pain, but it's muscle pain. Fibromyalgia is a muscle pain, which people suffer from, and medicine doesn't have much to offer. Ganoderma dramatically improves the pain from fibromyalgia in 6 weeks. This was a double-blind placebo-controlled trial where Ganoderma had more effective pain relief than the top drug for pain control of rheumatoid arthritis. And then here are a dozen plus mechanisms by which Ganoderma modulates the inflammatory process. So not just joint pain, not just muscle pain, but pain anywhere in the body. And there are numerous studies that show. So how about Ganoderma and interstitial cystitis? No studies on interstitial cystitis, but let's look at what the literature says about the cause, the etiology. And here's what it says. Although our understanding of the underlying pathophysiology is growing, the exact longitudinal course by which peripheral and central aberrations involving the bladder mucosa, peripheral inflammation, and central dysregulation of bladder sensitivity create bladder symptoms remains an area in need of further study. Here's what they're saying. We don't know for sure what causes interstitial cystitis, but we look at Ganoderma and the bladder specifically, 12 different studies on the bladder. That's where I found out it has effects on bladder cancer. But how about this post here in the Miracle of Organo group? She says, call me crazy, but I've suffered from ongoing bladder infections for, something, ! 5 years now. Every 3 months I was on antibiotics, which I absolutely hated taking synthetic drugs. What I never realized is when I started drinking black, I went 5 months without a bladder infection until I ran out of my coffee. Then guess what? Another infection. Coincidence? I doubt it, right? So you can see testimonies like that in the Miracle of Organo group. And here's what the medical literature says. 430 unique molecules within Ganoderma. 79 have antimicrobial, anti-parasite, anti-yeast, anti-fungus, antibacterial, anti-cancer action. Someone asked about hair loss. 3 specific studies on the most extreme case, which is called alopecia. 3 studies on Ganoderma and alopecia. Ganoderma, they also asked about pain, 18 studies directly on pain. How about diabetes? 88 studies on diabetes. And again, I'll show that case again and again. This woman was taking insulin, taking 2 insulin sensitizers, a bunch of other drugs, And then they were going to cut off her foot. And by the way, she's only 45 years old. And then look at what we were able to accomplish with 2 weeks of good supplementation to enhance health. And then 17 months later, when we start looking at Ganoderma in the heart, 37 studies on Ganoderma in the heart. Is it good for circulation? You bet. Lots and lots of mechanisms. And we look at circulation under that topic, specifically 12 results on Ganoderma and circulation. How about pneumonia? I put the copied and paste that. 3 results specifically on pneumonia. How about the lung itself? 72 studies on Ganoderma and the lungs. How about, this person asked about sleep apnea. There's not a study on Ganoderma and sleep apnea, but there are 8,276 studies on obesity and sleep apnea. And you know what? For some people, just losing 10 pounds can be the difference between sleep apnea and not sleep apnea. Again, more than a ton of studies if we were to not be figurative with that. And notice that it goes back over 60 years. Well, how about Ganoderma and obesity? 22 published studies how Ganoderma can modulate obesity and promote healthy weight loss. Someone asked about tinnitus, and this was from I didn't find a tinnitus and Ganoderma study. But here's what it said. There are many causes of tinnitus, including damage to sensory cells in the inner ear. It can be a side effect of medications. It can be a result of ear infections, high blood pressure, or even earwax, right? But it's the common is damage to the sensory cells in the inner ear. There are no known cures. However, hearing aids that create white noise have proven to be helpful. So now we go back to our testimonials. I'm only speaking for myself. I had a bad problem with tinnitus in my right ear, ringing and pounding, but gradually has diminished over the last few years significantly since I've been on organo coffee and spores. The king of coffee and spore capsules have been the only big change for me in the last few months. So I've come to think of it, maybe it's that which I should attribute to my ringing and pounding diminishing. So you know what? Here's my answer always. I don't know if it'll help, but it sure won't hurt. No known drug interaction, no known toxicity. We went through, believe it or not, all of those questions, and nearly all of them had solid direct data in the medical literature. And those that didn't, if you know what cause and effect are, you can look at that. So someone also asked, by the way, what about B12 deficiency? Ganoderma has all the vitamins and minerals. It enhances digestion. It revitalizes the parietal cells. It enhances the gut mucus synthesis, so it protects the gut. It eradicates gut infection. So would it help you absorb your own B12? Yeah, in all probability, there's good data on that. But with that said, Carol, anything in the comments?
Just trying to unmute. Yes, I do have a couple of questions for you. So Brendan's asking, someone brought to his attention that the bottle of spores in Canada warns users who have immune issues. Why would that be?
Well, Canada is the only country that has it, first and foremost, right? And so what that means is 35 other governments are either clueless or the government of Canada says, oh my, we don't want to take any risks on anything. We're going to put a, black box label on anything that has the immune system. And so, you look in the medical literature and there's 231 studies on my last evaluation on Ganoderma being great for the immune system. Now, let's look at that for a moment. If you have allergies, that's an overreaction to a foreign particle. Ganoderma is proven against allergies. We showed that. What about autoimmunity? Well, it says Ganoderma can treat or prevent autoimmune disease. That's an overreaction against your own cells. How about cancer? That's an underreaction against your own bad cells. We showed 16 different cancers and a whole bunch of studies on Ganoderma and cancer. Then what about other things in your body that could be infectious? 430 unique molecules, 79 which are antimicrobial, anti-yeast, anti-parasite, anti-fungus, antibacterial. There's even studies against HIV, H1N1, herpes, and even MRSA, methicillin-resistant Staph aureus. So Here's what I know. Me and my family take it all the time. It was safe for my daughter-in-law and daughter while they were pregnant. They took about 10 doses a day. And we all think our grandchildren are the best ever. And I do too, right? But I can tell you, these are profoundly healthy, beautiful, wonderful children.
Okay. So that actually covers one of our questions. So just to clarify, mycelium capsules would be great for pregnant or trying to conceive as well, correct?
Absolutely. And so when we look at infertility, what we know is that insulin resistance is a huge cause of infertility, and insulin resistance drives the ovaries to convert progestins into androgens, and that creates what are known as anovulatory cycles. If you don't mature an egg and release it, you're not going to get pregnant. The second thing is that estrogen toxicity. If you look at the birth control pill, the most common form of birth control has a very powerful estrogen called ethinyl estradiol. It's 100 times stronger than human estrogen. And what people would ask previously, or if I would ask doctors even at my seminars, how are you taught that the birth control pill works? What's the mechanism? And a lot of them, believe it or not, would answer, well, it fools the body into thinking it's pregnant. No, it screws up the hormones so bad you couldn't get pregnant if you wanted to. And there's a high percentage of women that don't recover. It's called post-birth control syndrome. So Ganoderma helps to clear those toxic estrogens. It also helps with the insulin resistance. By the way, obesity, for every point that body mass index goes up, fertility goes down 4%. And that can be an estrogen toxic circumstance, an inflammatory circumstance, an insulin resistant circumstance, or all of the above. And as we showed, Ganoderma has proven benefit for every one of those circumstances.
Okay. We have a question wondering about how it can help with Crohn's.
So it's autoimmune. And by the way, Crohn's is one of those in our office that we just have a really good track record going back 30 years now of people having really good, long-lasting remission. So Ganoderma is one of four. So we have a Zoom on autoimmunity. It's available in the groups, but there's 4 universal immune modulators. One is vitamin D. Get out in the sun if you can. It's better to make it. But if you can't, the World Health Organization says safe upper limit is 10,000 IU. Another is DHEA. In some countries, it's a prescription item. I think that's crazy. In the US, you can get it over the counter easily. But DHEA is a great immune modulator. And then we have 2 Chinese botanicals. One is perilla and the other is Ganoderma. And we have plenty of cases that are in measurable remission fast with the right protocol.
Perfect. Can you take Ganoderma with bipolar meds, benzos, and antidepressant?
No known drug interaction, no known toxicity. And so ultimately what's going to happen is you're going to improve brain circulation, brain function, brain health. And ultimately, it would be nice if they had something easy to monitor, rather than symptoms with these medications. And so what we know is if you take someone with imbalanced brain chemistry and you pharmaceutically push it too far in a direction, that's a problem, and then also the brain is going to adapt to whatever changes you give. If you push a certain brain chemical too far, the body starts to ignore that chemical. And that happens, by the way, of medications as well. So, ultimately, we'll go with Daniel Amen. What if mental health and brain health are really tightly related? And what if we could improve brain health? Could we improve mental health? And we've got plenty of data that shows that we can, including data that Ganoderma is good for the 4 major neurotransmitters: serotonin, GABA, acetylcholine, and dopamine. It also induces brain stem cells. It's also known to be anti-Parkinson's and anti-Alzheimer's. By the way, it dissolves the amyloid plaque associated with Alzheimer's as well. So some of the best brain food around. And here's what we know. We have a lot of brain problems because our brains are stressed, our brains are toxic, our brains are malnourished, and sadly, our bodies are physically inactive. And you'd be surprised how important a fit body is to create a fit brain.
Perfect. What would your suggestion be for tongue cancer?
Well, we had cases of tongue cancer that did really, really well. I can put in the chat, or I'll send my major one, but I've got a 3-hour audio from a conference that I did with 520 doctors with over 250 scientific references on nutrition and cancer. And Carol, I'll send it to you.
Okay.
Because just the way I'm on right now, it's not convenient for me.
Yep, that's fine. I'll get it in the chat after I answer a few more questions.
So there it is. Oh, it's playing. Okay, there we go.
Perfect. Okay, so while I'm pulling that up to put in the chat, Elena would like to know if you can pull up the slide about how it helps with radiation resistance.
Sure. So that was specifically on liver cancer. And there's also that on protecting the heart in radiation cases for lung cancer. So there you go. So that's PubMed ID 292-85139.
Perfect. Just give me 1 second. I'm just copying this. Okay. Can it help with hot flashes?
So pretty fascinating phenomena. And I usually give a long explanation on this. I hadn't looked up that particular study. So here's what we know. When the ovaries are fully functional, they're responsible for 100% of the woman's sex steroids. But as the ovaries eventually decline, you know, when a young girl is born, she's born with over 1 million eggs. By the time she's 37, she's down to 25,000 eggs. By 52, typically down to 0. The Swedish term for ovaries is egg stalkers, and I always find that fascinating. But when there's no more eggs, the egg stalkers close shop. So you can look up the term intrachronology, and I can type that in the chat. Send chat to everyone. I think someone might have private messaged me, which I don't tend to look at. So intrachronology.
Send them.
And here's what we know.
Send things to me.
All the cells of the body have that need estrogens and progestins and even androgens have the ability to make them. And the hormones are made within the cell, used within the cell, detoxified within the cell. And so here's what we know, quite simply. Since the hormones are made inside the cell, used inside the cell, measuring the blood is not a very effective way to look at menopausal hormone levels in a female, first and foremost, right? You want to look more at symptoms and function and things like that. But it's made from DHEA. And DHEA is the first adrenal steroid that's depleted in chronic stress. And the medical literature says that nearly everybody, or quite possibly everybody, has chronic stress from blue light, from other things that weren't really in existence in our world before, and they're DHEA depleted, and therefore that creates a challenge going into menopause. And also there's a thing called andropause, and what that means is after the age of 50, and there's a few of us on here that I see that are over 50, half of our testosterone, half of our androgens are made by that same mechanism, by intrachronology. So we want to keep our stress low to keep our DHEA good and keep our bodies fit, strong, healthy, lean, etc.
Okay. Another popular question that we get a lot is about endometriosis.
Yeah, so we had a whole Zoom on that, and we had some very phenomenal cases there and lots of data that supports it. So keep in mind, and you know, visuals are better, but I don't have a female body to share this with, but you know, I have a abdominal cavity, I have a pelvic cavity. Now, if I had a uterus in my pelvic cavity, what's fascinating is the uterus has these little thing called fimbriae that go up, and there's ovaries that are essentially above the pelvic cavity. When the ovaries ovulate, they release an egg, and the fimbriae grab it and pull it into the fallopian tubes and ultimately into the uterus. And so the uterus is preparing for implantation, potential implantation of an egg every single month. So that uterine lining builds and gets extra vasculature to nourish that egg if it gets there. Well, ultimately, when that lining sloughs off, because there's an opening from the pelvic cavity to the abdominal cavity, some retrograde menstruation is estimated to exist in every female. Now, what should happen in that case? The immune system should come by and say, that tissue doesn't belong here. Let's clean that out. And so ultimately, it's an immune phenomena which is aggravated by estrogen toxicity. So we know Ganoderma is really good for the immune system. We know it's really good at killing bad cells. We know it's good at controlling the inflammatory process. And we know that it clears horrific estrogen toxins. And even though we didn't call out the specific estrogen toxins in this presentation, the data is there in the medical literature. So phenomenal data supporting endometriosis.
Perfect. Does Ganoderma remove mucus from your cells?
Well, mucus is formed for a reason, and it's often it's either to lubricate or it's in response to irritation. So could it help get rid of an irritation or an allergy type phenomena or infectious type phenomena? Yes, to all of the above of those. But mucus may not be the problem. The trigger of the mucus is more likely the problem.
Okay. Someone's asking about multiple sclerosis.
Yeah, so that's an autoimmune etiology. It's, the attack is occurring on the white matter of the brain. And we have some phenomenal testimonials. I've got one, I think I entitled it From Wheelchair to Wonder Woman. This woman was digressing really, really, really fast. And, she had a very tearful testimonial because she was trying to say, what am I going to do if I die? I've got 3 kids, I'm 30 years old. And literally within 2 weeks, she was able to get out of a wheelchair. So it's pretty fascinating when you control the brain inflammatory process. A gentleman saw that, reached out to me. I put him on a protocol. He had not had use of an arm. One of his arms, he was in a wheelchair. He hadn't used one arm for 2 years. Within 2 weeks, he started getting the use of that arm back. Now, we don't ever promise a guarantee. No one can ever do that. I always have one guarantee, I'll always do my best. And my best has been pretty good for a lot of people. And you know what? You come on here, you can get plenty of insight as to how you can apply this.
Okay. Can you talk a little bit about how it can help skin?
So if we take the word Ganoderma lucidum, literally derma like skin, lucid like bright and shiny, it's actually quite known for the skin. And there's so many ways that it can help the skin, but what a lot of people don't realize about skin is it's the largest organ of detoxification within the body. A lot of things that are coming out of our skin that's just the route that they've chosen to leave the body. So if we can enhance the other detoxification pathways, if we can enhance the lungs, yeah, that's detox. The kidneys, the liver, the bowel, the lymphatic system, all of those things can ease the burden on the skin, and then there's direct help to the skin. And that's also in the medical literature.
Okay. Can Ganoderma help with myeloma and kidney disease?
So one, they're talking about multiple myeloma, which is a bloodborne cancer, and it can cause severe protein issues with the kidneys. So given that it's proven to help with multiple myeloma and it's proven to be good for the kidneys, the combination there says, yeah, there's data to support it. Now, here's the important question, is this a cure-all for everything? No, bodies respond to frequency, duration, intensity, quality, and timing of stimuli. We would want to unwind the perfect storm of cancer in every way that we know possible. We'd want to support the kidneys in every way that we know possible. And when people are in those circumstances, any choices that they're making that are less than healthy, we want to minimize. And then healthy choices, we want to maximize. And the nice thing about Ganoderma, I tell people bodies respond to frequency, duration, intensity, quality, and timing of stimuli, no known toxic dose. So I will often have people dose this every waking hour in the form of a capsule to jumpstart the system. And that's one of the most effective interventions we have.
Okay, the questions keep coming tonight. What about parasites?
Well, it's anti-parasitic. So, will it kill every parasite? Well, I doubt it. There's probably nothing out there that kills every parasite, but here's one thing that I tell people, parasites only attack weak tissue. And so if you can build the tissue and weaken the parasite and possibly, create good competing organisms, et cetera, then there's always hope to eradicate it. So there's good evidence for that as well. But there might be some parasites where there might be a known medical remedy where it's a one and done pill or one and a week later. And then you have to weigh the risk benefit of that because it will be pretty toxic, but it might be worth doing.
Perfect. Just trying to catch up with the chat here. Migraines.
We have plenty of those testimonials, and I often share a reference that says this: Ganoderma is known to completely eradicate migraines without side effect in the majority of patients. That's right out of the International Journal of Pharmacy. So powerful language there.
In regards to skin, someone would like to know if it builds collagen.
Well, collagen is a connective tissue protein, and there's a lot of things that have to be right for collagen to work, right? So does it help enzyme efficiency? Sure, by changing the pH. Does it prevent breakdown by modulating the inflammatory process? It does that. Does it have micronutrients to help the process? Sure. But, here's what one of my mentors told me years ago: eat muscle to grow muscle. That's the most efficient way to grow muscle. Well, eat collagen to grow collagen. There's a lot of good collagen supplementation. So I would use Ganoderma to enhance my overall health, and I would get a really good, clean collagen to work on building collagen. And I'd also figure out if you're doing something to break it down, stop that, whether there's an excessive inflammatory process, a bad movement pattern, a combination of the above, an overuse syndrome, all these things can happen. And ultimately, you case by case, you have to create the protocol that works for the person.
Okay. One of our guests have found a lump on their breast. So is the doctor in the middle of November. They haven't made any decisions yet on moving forward. They would like to know if Ganoderma will help shrink the tumor.
Well, we don't know till we try, but that's an obvious go to the doctor and get it checked. So there's certain things we don't mess with. The safety of anybody is right at the top of that. You go to someone you trust, you get a good exam, and then you do the appropriate follow-up. Now, I'm not a big fan of mammograms. One of my great mentors said this of mammograms. He said, we will continue to radiate the breast until we detect the cancer that we've caused. And then Archives of Internal Medicine published a study that showed that women that had consistent mammograms had 22% increased risk of invasive breast cancer over those women that didn't have it. And so here's what we know: radiation induces DNA damage by inducing single strand breaks, double strand breaks, oxidative lesions, and or all the above. And that's right out of the medical literature. So high risk people, one, you should do a self breast exam literally every week. So, in the natural circle, we talk about natural things all the time. There was a really great 50-year OB-GYN that said, okay, ladies, now I'm going to have a conversation with you. You work so hard, you do so much for your family and our world. Every day you deserve a little downtime. So go and draw a hot bath, sit in the tub, have some soft music, read a book, get away, get that quiet time. And while you're in that bath, you wash your armpit. And then while you're washing your armpit, feel around, start paying attention, start getting into the tail of the breast, go feel, work around, find out. And if you find anything unusual, you owe it to yourself to get it checked out. And then you do the other side. How long does that take? It takes less than 2 minutes once a week. And somehow, some way in this country, the US, and I know we have multiple countries here, they said, yeah, self-breast exams don't bother. Well, that's ridiculous. You need to know your body. You need to know how it changes. And if you see a change, you need to have it evaluated. Now, is Ganoderma proven against breast cancer? It is. How about fibrocystic breast? It is. How about infections and cysts? It is. So does it unwind the perfect storm of cancer? It does. So, can I endorse it? Sure. But if you find a lump, get it checked out. It's just that simple. If you have a lump and you get it early and you get it cut out, guess what? It's gone. And then you figure out, what did I do that allowed that perfect storm to exist, and let me not do it again. Just that simple.
They are very small.
Perfect. Okay. Scrolling down a bit. What about gastroparesis? If I said that right.
The gut has a very sensitive nerve system. And I think I answered a similar question maybe last week on it. And here's a fact: diabetes is really bad for nerves. including the nerves of the gut. And that's one of the more common causes of gut challenges and gastroparesis. So remember the picture of the foot. If the nerves aren't dead, if they're functional but not functioning, we can bring them back. If they're dead, we have a problem. But the way we bring them back is by, doing as much good as we can and eliminating as much bad as we can. If you're diabetic, we need to get that under control, and even ideal sugar regulation. So that woman, Maureen, with that foot removal that she was threatened with, the doctors were perfectly happy with her blood sugar regulation, even though a hemoglobin of A1C of 7.0 created that foot in a woman who was 45 years old. And here's what happens with amputations. First, they take half the foot, then they take the rest of the foot, then they take the leg, then they start on the other side, then you go blind, then your kidneys fail, then you die. But we got her A1C down to 5.0, and that's even with the destroyed pancreas, being a type 1 diabetic from age 5 forward. So can it be done? Yeah, we've got cases where we do it. So, Tony Robbins has a great quote. He says, raise your standards. Raise your standards for your health and what you can achieve. And, can anybody achieve anything? No, but I promise you, everybody can improve. So let's use that as our standard. Let's improve every day, and preferably in as many ways as we can.
Okay. So I've got two more to go with here. So one of our friends here, their husband hasn't kept food or water down for 3 days. The doctor has no idea what's causing it and just told them to continue to push fluids, to call 911 if any blood is in the vomit or stool, because the kidneys could be failing. Are there any thoughts of what to give him or how to help this situation in any way?
Well, this is basic medicine, IV fluids. If the gut isn't handling it, the veins will. And so, I don't understand any recommendation other than go and get an IV with electrolytes and maybe D5W, right? You run the numbers and you see what's going on. Something's irritating the gut. Now, could Ganoderma help? Sure, but if I had a loved one that didn't have fluid for 3 days, I'm going to drive them myself to the ER, and I'm going to say, hook this person up to an IV. It's not any more complicated than that. You can die of dehydration. You can push the kidneys toward kidney failure. If they're not having fluid to filter, you can have circulatory collapse. That's irresponsible. Get some fluids. Now then, in the meantime, take Ganoderma spores every waking hour and see if that helps your gut. But, go to someone who can offer a reasonable solution and deal with the acute circumstance. If you don't have fluid, you need fluid. It's almost like saying, yeah, someone hasn't breathed in, 3 hours. What do I do? Well, that's too long, right? You need air, then you need water, then you need food. They're running out of water.
Okay. And another question, do any of the products help blood clots in the lungs or legs?
Well, where they are is irrelevant as long as blood supply gets to it, and Ganoderma is in the blood supply. So literally within the medical literature, it says that Ganoderma has a fibrinolytic protease that helps to break up blood clots. And by the way, it prevents abnormal clotting without promoting abnormal bleeding. And so I created a little video about that because so many people are given so much bad information. Nature's molecules are so powerful. They have all kinds of checks and balances and things within it. If you were to give a medical something to break blood clots and nothing to buffer it, you could cause a big problem. But what do? Nature has everything to buffer it in a very good way. So ultimately I would take it, but let's find out what's causing the blood clots and get after that.
Okay. Someone's asking how much and how often should you take Ganoderma?
I'm having a little dog challenge here. So what makes it simple is you take coffee or tea that has it and see how your body responds. And then you take more if you have a higher level need. So my gold standard is if you have something that you want to get rid of fast, take 2 spores every waking hour. But you ought to be able to maintain health with a reasonable coffee and tea habit once you get to that level. And that's the magic of having Ganoderma in coffee and tea.
Okay. All right.
And yeah, I think we need to give him another dose.
All right. Can Ganoderma cure or help chronic constipation or IBS?
So it's supreme for the gut by a lot of mechanisms. And, here's what I tell people. The gut is solved by essentially 5 questions. Number 1, what are you eating? Number 2, how's your digestion? Now that would include hydrochloric acid, gallbladder effectiveness, pancreatic effectiveness, even small intestines there. Next, what kind of bugs live in your gut? Next, how often do you poop, which is fiber, water, and neurologic tone. So that's essentially eating and drinking. So I should include drinking in there. And then finally, do you have a leaky gut? And, to some degree, everybody has a leaky gut. The healthier you are, the less leaky you are. And that's why you want to chew your food so that you get that part of digestion down really, really well. You want to do smaller meals because that's easier on the digestive system. When people have challenges, I have them do what's called mono meals, 1 food per meal, because it's easier to digest one food than it is complex foods. And by the way, you go on the scale of digestion, fruits are the easiest to digest. Some people need to avoid fruits because of the sugar content. Next then is going to be vegetables. Those are relatively easy. I'm not a big fan of grains. In fact, I'm mostly a no grain kind of guy. And then ultimately we start bringing in animal products. From animal products, fish is going to be the easiest to digest. Then we start moving to fowl, and then, stronger land animals. Those are more complex and a little harder to digest, but a good digestive system, well treated, ought to be able to handle that for a lifetime. We're designed to have good health for a lifetime if we take good care of ourselves. And by the way, toxicity is one of the major factors that suppresses hydrochloric acid production, and so is stress as well.
Okay. If you take too many vitamins, you tend to urinate the excess. Can this happen with Ganoderma capsules specifically?
Of course. Yeah, there's definitely water-soluble components to Ganoderma capsules. There's also fat-soluble components, but here's the fascinating thing. The body has a phenomenal way of regulating the fat-soluble components of the Ganoderma that even with thousands of doses infused daily, no toxic symptoms noted. So it's pretty fascinating there.
Okay. And if somebody doesn't have a gallbladder, that can cause problems with digestion, but can this help?
Well, if someone doesn't have a gallbladder, something was missed in the first place. And it could be an estrogen toxicity. There's a very unflattering, 5 F's of gallbladder, the fat 40 fertile flatulent female. The fat 40 fertile female all has to do with excess estrogen, and the flatulence is the poor digestion. But the primary acid in gallbladder is actually called taurocolic acid. That requires taurine. The body has to methylate appropriately to make taurine. If you're overoxidized, that is going to be something that's going to deplete part of the methylation pathway. Methylation also is a part of making something called metallothionein proteins, which, by the way, also have a lot of zinc. So as a society, we are profoundly heavy metal toxic. So then we are depleting our precursors to make taurine, and therefore we don't make much taurocolic acid. By the way, taurine also prevents anxiety, also prevents cardiac arrhythmia. And you start looking at people, where does it hit them first? Where are they genetically weakest? Is it their gallbladder weakest, or their diet so poor? Is their cardiac membrane stability, therefore they get arrhythmias? Is it their brain, therefore they get anxiety? But all these can point to the same thing. Someone that doesn't have the right balance of nutrition, too many toxins. And can Ganoderma help with that? It can. I probably wouldn't do that straight up. There's lots of good herbs for gallbladder. One of my favorites is actually artichoke leaf. I have a tincture of that, very calming to the gallbladder. And then gallbladder flushes, people can look that up. I have had plenty of people that have been told, hey, you need to have your gallbladder removed. Now, here's the interesting thing. They'll test the gallbladder and they'll say, it's only functioning at 23%. We need to remove it. And I'll ask, well, what percentage will it function at when they remove it? So that sounds like 0 to me. So wouldn't 23% be better than 0? And could we get 23 to 25 and maybe 27 and maybe 30 and maybe 35? And then we make some appropriate dietary changes, and 35% is more than enough for healthy digestion and healthy living.
Okay. So somebody's asking 3 different questions here. And I know that we cannot make any health claims. Does Ganoderma help with COVID, autism, and mental health?
Well, it's a very proven antiviral. We did a Zoom on autism, and here's the first thing we know, that toxins are profoundly implicated in the autism pandemic, and I'll call it a pandemic. And one autism accelerator, and that's what the medical literature used, is glyphosate, which is Roundup, which is being sprayed everywhere for these genetically modified plants. It's literally called an autism accelerator. By the way, Tylenol and the antibiotic Augmentin are also listed as being implicated in autism. So when you look at Tylenol, is it a toxin? It absolutely is. Does it compromise the liver? It does. Does Ganoderma help with toxins? It does. Does it help with pain? Sure. Does it help with infection? Yeah. Could it be a good option? So stop eating the genetically modified stuff. Don't even support that industry. But then item number 2 is now there's data that the vaccines contain glyphosate because genetically modified materials are in there. So boom, if you're injecting a child that's just out of the womb, the blood-brain barrier isn't complete. And what do they vaccinate for with after birth here in the US? Hepatitis B. So by the way, how does one get hepatitis B? Anal receptive homosexual sex or the sharing of IV drug needles. And I remember sitting with a pediatrician when our son Jacob was about to be born, and she says, well, of course we want to vaccinate your son for hepatitis B immediately. And my wife is sitting next to me, and for her benefit, I said, well, doctor, I have a question for you. How does one get hepatitis B? She said, well, that's anal receptive homosexual sex or the sharing of IV drug needles. And I said, what makes you think my son's at risk? He's in utero. And she said, well, you just don't know how he's going to grow up. And I said, we're going to cross that bridge when we get there. By the way, they also gave a bunch of young girls the HPV Gardasil vaccine, which is known to increase the risk of autoimmune thyroid by 29%. And that is in the medical literature. So I had a gymnast that had a full scholarship for Michigan State that lost her scholarship when she got the Gardasil vaccine, developed an autoimmune thyroid and gained 50 pounds. Kind of hard to do floor exercise 50 pounds heavier. So we've got to look into these things. It's just that simple. And by the way, am I spouting off opinion? No, I'm sharing published medical facts. And go look at that narcolepsy study that I put in there. Narcolepsy is caused an autoimmune attack triggered by vaccinations. That's right in tonight's presentation.
Perfect. Well, I think you've just gone on a marathon for tonight's call for sure. And that was the last question. We've got a lot of people saying that you rock because you're awesome. And we do all agree with that. So how do we access the Zoom studies Dr. Bob talks about? So that would be on our groups.
Yep. And you know what? So yeah, in Why Organo, if you haven't been added to that, this Zoom is simulcast there. So there may be other viewers that are not on this tonight, but and I'll tell you, don't take my word on anything. That's why I give the references. You go and you type that in and you go ahead and look at the medical study and then go to PubMed and go, oh, Ganoderma lucem. Wow, nearly 1,900 studies. That's pretty fascinating. Oh, in the brain, over 50 studies, or in the heart, over 37 studies. How about the immune system? 231 studies. How about the liver? I don't know, 100 studies. You start looking at that and go, wow, this is really, really good. And what we also showed, if there isn't a study like on narcolepsy, well, what causes narcolepsy? Autoimmunity. Well, does Ganoderma help with autoimmunity? It does. Does it protect the brain against toxins? It does. Could it have prevented that? That'd be a good study. But here's what I know. I put it in my body every day, and I recommend you do too. Just simple enough. So I'll end with 4 questions since we're wrapping it up.
Perfect.
Unless you want to say something else. So, I love these 4 questions. So the first question is why? Why'd you take the time to be on here tonight? Second question is the answer to the first. Why not? Why not learn about something that can impact your life and maybe a lot of other lives in positive ways. Third question is, why not you? Someone's going to say, this makes sense. I'm going to check it out. I'm going to check it out in my body and actually see what happens. And here's the final question, why not now? The longer you wait to act on information, the least likely you are to act on it. So get back with whoever invited you to this Zoom and talk about your next step, because I promise you, there could be a really good step for you if you want to take it. And I like to wrap up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. Good night, all.
Thank you, doctor. Thank you, Carol.
Thank you, Dr. Bob.
Thank you.
Thank you.
Thank you, Dr. Bob.
Good night, everybody.
Thank you, thank you, thank you, Dr. Bob.
Thank you.
Thanks,
Thank
Dr.
you, Dr.
Bob. Good
Bob.
night.
Thank you, Dr. Bob. Bye, guys.
Good night, all.
Thanks, Dr. Bob.
You are
Bye,
very
guys.
welcome.